Hello and welcome to Join Our Town. I'm your host, Tammy Jo Johnson. Join Our Town brings you the issues and problems that are faced in the local community with the hope of finding a solution. Our guest for this segment is Laxmi Mehta, MD, Director of Women's Cardiovascular Health and Associate Professor for the Ohio State University Wexner Medical Center. She joins us today to share important information regarding women's heart health, along with how women can prevent developing heart disease. Thank you so much for being with us today.
Thank you for inviting me.
So I'm so glad I didn't mess up your name. You are a MD at the Ohio State Wexner Medical Center, and you treat women's hearts.
Yes.
Tell us a little bit about what you do.
Well, I treat men and women's heart, but I have a special focus on women. So I'm a preventative cardiologist. So I see patients maybe before they have heart disease, if they have a family history or they're just concerned about their heart health. And certainly I treat patients after they've developed heart disease. I also have a certain population of patients that have unique types of chest pain that may not be diagnosed elsewhere as the cause of why they have chest pain. And so I see some unique cases of women's heart disease as well.
Wow, I really like the term, the preventative cardiovascular. So you see patients that may be having some issues, but it hasn't been diagnosed yet?
Yes, yes.
Wow. Are you strict with them? What do you tell them? Tell us what, first of all, tell us what causes issues with the heart in men or women.
Well, there's lots of issues that can result in heart disease. I mean, we look at different things as if people have high blood pressure, if they have high cholesterol, that can lead to heart attacks, even strokes for that matter. But smoking is an issue that people tend not to listen to because they think it's not going to happen to them. They know someone who's older that hasn't had heart disease or cancer or strokes, but those are fluke cases.
Right.
And so trying to promote patients to understand what are their own personal risk factors and then having them understand it, accept it, and take ownership for it is important.
Well, as a professional, it's documented, and it says that smoking can cause heart disease. Why do you think people ignore that?
People ignore it because they don't experience it. If they're not having those active symptoms, sometimes they're not willing to believe in it.
Like
but
out of
also,
sight, out of mind.
Yeah, and also for a lot of people, that is their way of relieving stress. And they seem to think that that's the only way to relieve stress, which is not true. And then it's an addiction, smoking. And so if they're surrounded by people that smoke around them, it's really hard for them to quit. They really need to separate those ties with people who are smoking.
Can you give us some differences between, because you said men, you kind of corrected me on that, which is good because I guess I never thought men had as many heart issues as women, but the heart is the heart. Can you tell us what are some of the difference between the men issues and women's issues?
Well, in the past, we always thought heart disease is a man's disease in actuality. It's changed in that there's more awareness that women have heart disease as well. So men and women both can have heart attacks. They can have abnormal rhythms to the heart. They can have heart failure. They can have high blood pressure, high cholesterol. But what's unique is what we know about heart disease has always been studied in men. So like what are the symptoms or signs of heart attacks, how to treat them, we've all know about in men. But women have unique forms. So women don't necessarily need to present with the same sort of symptoms of a heart attack or blockage in their heart arteries as a male. And so that's what's unique about it. Plus the way the blockages form, how do we treat them, can be very different. Many women are told that they have anxiety, and it's not really that they're experiencing chest pain because their symptoms are a bit different. And so that's what makes it a challenge.
Wow. And it says, according to the National Center for Disease Control and Prevention, that heart disease is the #1 killer of women of all cancers. And that's true, right?
Yeah, most people think that it's cancer that will get to them. And especially more women worry about breast cancer than having heart disease. And that's a problem because even if women develop breast cancer, they still have a heart, and their heart can result in problems. Also, the treatments for breast cancer can sometimes affect the heart. So we see many patients that are undergoing cancer treatment all types of cancer treatment that also can have underlying heart issues that were undiagnosed, but now they're seeing a doctor more regularly that they're picked up, or secondary to the treatment, either early on in the treatment, or it could be years down the line after they've survived their cancer, they can have some late effects of the treatment.
So are there symptoms? Is it hereditary? How does someone come into heart disease?
Well, definitely there's a hereditary component to it. So knowing your family history is key, but there's also risk factors. So as we talked about, smoking is certainly a risk factor, but having high blood pressure, and high blood pressure is a silent disease. People walk around with high blood pressure and don't even know that they have it. High cholesterol, having diabetes, and diabetes is a worse risk factor in women than in men. And so that's a problem. Obesity, sedentary lifestyle, high stress levels, they all can contribute to it. So understanding what are your personal risks and how can you modify them is key. 80% of heart disease is preventable, but you actually have to know what your risks are and then take action.
And when should that action be taken? Should they start going to the doctor as soon as they hit a certain age, or is this like a regular yearly thing?
Well, I think everyone should be seeing a doctor at least on an annual basis. It's not necessary that they need to see a cardiologist like me, but they should be seeing their family doctor to make sure that blood pressure, which is silent, is checked, that periodically they have their cholesterol checked. If they're at risk for diabetes, having that checked, having their weight checked. Many people don't even want to step on the scale, but it's okay. It's better to know. Knowledge is half the battle.
It is. So, you know, I know that women are obviously more likely to get heart disease. How does that affect them emotionally, do you think?
That it affects women strongly emotionally, heart disease. Well, many women suffer from depression, and depression is a risk factor for developing heart disease.
Really?
But also, even if they've never had depression, just the sheer diagnosis of heart disease can be quite depressing on women, and it'll increase the risks of subsequent heart attacks, just suffering from depression. So recognition of depression, both by the providers, but by family members and friends, is key. And the problem with depression is if you feel depressed, then you're not apt to take your medications that can help improve your heart. They're not apt to do the lifestyle things as watching what you're eating, not smoking, exercising. So it ends up being a vicious circle. So keying in on depression is an important, depression and anxiety. And what we also know is this one aspect of depression that's not talked about is childhood abuse. I mean, out of the two genders, women are more likely to be abused than boys, and or girls more than boys, and that can have late-term effects in developing heart disease.
Who knew? Because I know, you know, when you hear information on depression, it's psychological. It's not necessarily physical. So how is that connected to the heart? How does that affect the heart mechanically?
Well, it's the psychological aspect makes you not take good care of yourself and poor choices. There's also something else called stress-induced cardiomyopathy, where someone can have a lot of intense stress or severe depression that can lead to severe heart failure.
Wow. So where do you start with women that you may see? Like if a woman comes to your office, she's obviously been diagnosed already, correct?
No, sometimes I'm the first person to diagnose them, or we can help prevent some disease processes. So someone may not even have a diagnosis. They may be walking around thinking they have anxiety even.
So how would you treat them? What is that assessment like to determine whether or not they suffer from heart disease?
Well, really paying attention to the symptoms. I think for women, you have to really understand and kind of pinpoint them on what are their symptoms. And also it's understanding that women have unique and different symptoms than men. What I was fortunate to do was chair the American Heart Association's first scientific statement on heart attacks in women. And that really was great because it reached international media. And through all those media outlets, it's going to help women across the world understand, and their physicians and the nurses, understand that there are these unique symptoms and unique ways that women have heart attacks versus men. And so hopefully that'll help open the doorway for more women.
And so going back to that question, at what age should they start getting, should they make it an annual thing like when they start their PAPs, or Can heart disease be found in children or in youth?
So we find it in utero. There are some congenital heart diseases. Atherosclerosis, or the plaque buildup that we think of that can result in heart attacks or blockages, can start from childhood on. It may just be early signs of it. And so heart disease, preventative lifestyle should be from womb to death.
Wow. So for our viewers, if you could give us just some tips on how to either go in and see a doctor if you think you have heart disease, or how to even just start doing that taking those preventative measures so that you don't even have to really do that.
Yeah, so I mean, everyone should go and see a physician and have their blood pressure checked, have their weight checked, their cholesterol checked. They need to talk to their doctor, especially if they're having any sort of symptoms with activity. They need to be talking to their doctor about, can they start an exercise program? Those are simple tools. There's lots of information online as well about heart disease, about steps to take. So for instance, the Ross Heart Hospital at Ohio State University has a lot of information available there. The American Heart Association has information there. So many different venues, but seeking the information online is one step, but then taking it to the physician and having that discussion about where does that relate and making it more personal is an important step.
So, you know, as we begin to wrap up, the one question that I know that a lot of people have is, you see athletes or you see people that are seemingly in good health and they all of a sudden die because of a heart attack. How do you explain that?
Well, so many times that's a different type of heart disease that they have. It's a thickening of the heart muscle. It's hard to diagnose those conditions when people are feeling well if they're not seeking medical attention. So we are trying to push at a state level of really paying attention to athletes' symptoms, because often an athlete, they may be having symptoms but are in denial as well, and try and avoid it because the athletics is their life, and they would hate to have it stopped. And so trying to catch some of those early signs. And one thing in the state of Ohio has been great is you have to have a physician sign off that you can participate in any athletics. So you have to be seeing a physician, and that's key because we can listen and hear those murmurs and catch things earlier.
Wow, thank you so much for being here with us today. Is it possible for you to leave your contact information or the website if someone wants to get more information?
Sure, they can get more information at the Ohio State University Wexner Medical Center's website on heart disease symptoms. They can also have information on women's heart health, and through there there's links on finding a physician.
Thank you so much.
Thank you.
Coming up next on Joy in Our Town, arthritis. Stay with us, we'll be right back.